Hey everybody, welcome to the early birds. We'll be on here for about 10 minutes before we really get things going, but I'd just like to tell folks that you are muted upon entry, and we'll just unmute speakers when they join, as well as folks who submit questions to the chat later. So I know it's a little lonely with just me talking, but just wanted to update you on that front. Hi, Miles. Hey, Brian. All right, everybody, we're going to give folks a couple more minutes to jump on, including our speakers. I've mentioned this to the early birds, but just so everybody knows that they're muted upon joining. We'll unmute if you have a question to ask during the Q&A portion. I will unmute you. And so feel free to use that chat function to submit those questions as they come to you. And yeah, we'll get started right around 1:30. We'll get going in just a few minutes, everybody. I know we are waiting on Matt and Mark, but once they're here, we'll get this going. Okay, thanks for being here, everybody. We're just going to give Matt and Mark a few more moments to join us. Those of us who've been here for a few minutes know, if you have questions that you'd like, hi Matt, that you'd like Matt or Mark to answer during the Q&A portion that will come at the end of the call, please submit those to the chat. And I will unmute you to ask your question when that time comes. Everybody's muted. So if you have a question, make sure that you submit it there. Let's see if we've got Mark yet. We've got Matt here. I just want to make sure we give Mark another second to join us. Emily, I know you're here as well, so if we're waiting on Mark. All right. We're going to give Mark a few more seconds, but I'll just go ahead and get things started on our end. So my name is Emily Boyce. Thank you everyone for coming. I'm the Development Director for Equality Illinois. My pronouns are she, her, hers, and I am joining y'all from my apartment in Logan Square today. I'm very grateful for that you're all here. And some of you are familiar with the format, some of you aren't. So we'll talk a little bit more about that in a second. But as I mentioned a few times, please feel free to use the chat to submit questions that you might have around this topic for our speakers to address during the Q&A. Before I introduce our CEO, I do want to give our communications director, Miles Brady Davis, just a minute to talk to you guys a little bit about resources that you can find directly from Equality Illinois. So Miles, I'm going to unmute you now.
Thank you, Emily. Hello, everybody. It's great to see everybody. Hope everybody is taking care of themselves during this time. Yeah, as Emily mentioned, I just want to take a second to plug our COVID-19 resource hub that we have available on our website. I had just shared in the chat the link to our resource hub. It's a great first place to start to look for available resources that are out there for everyone. And I've also shared in the link a resource shared link. If you go to our resource page and you see, and if you know of a resource that is not on the page, please feel free to click the link and share the resource with us so we make sure that everybody has access to all the great information that's out there.
Thanks, Miles.
Thank you.
With that, I'm going to turn it over to the wonderful Brian Johnson, Equality Illinois CEO.
Great. Hi, everybody. It's good to see so many of you here. I will say, as I notice that as these town halls go on, we have roughly the same number of attendees, but the number of you willing to put your face on goes down and down. So for those of you that I can see, I'm happy to see your faces. Again, I'm excited to have everyone join us for our town hall conversation on mental health during the COVID-19 crisis. Again, our hope with these town halls is that you walk away with some reliable information and actionable next steps on this topic, as we do with all topics. And we want you to feel connected to both partners and experts in the field, as well as each other. You know, many of us are looking for ways to gather during this time. And while we can't do it in person, I'm grateful that we have this opportunity to spend some time, at least virtually, together. A couple of other key housekeeping things. These calls are open to the media. I see we have Matt from Windy City Times. Always happy to have you on the call, Matt. So if you do not want your face or name shared, please mute your video and change your screen name. Our town hall is going to go till about 2:30. I will start by introducing our guests and lead a couple of questions in the beginning to get the conversation started. But at any point, you can start by putting questions that you want to hear answered into the chat box. And then when we open it up for questions, Emily will call on individuals one by one to read their questions out loud. Finally, as facilitators of this conversation, we always like to remind you that we hold all participants to the same standards of being inclusive, safe, and respectful to all. If someone does not demonstrate those values, we are going to remove them from the meeting. So let me start with some introductions. You know, I also have to say, this is my version of dressing up today, but I see Mark has a jacket and Matt has a tie. So I haven't seen those in a long time. So I feel underdressed for this occasion. But we have two strong leaders here to lead this conversation. And I know many of you know these two. I'll start with Mark Ishaug. A titan of the community, is the CEO of Thresholds. He's previously served as the president and CEO of the AIDS Foundation of Chicago. And he serves on the boards of directors of the National Council for Behavioral Health, Forefront, the Civic Federation, and the Illinois Association for Behavioral Health Care. Matt Richards is a healthcare administrator and licensed clinical social worker with 10 years of experience in healthcare and clinical administration. As Deputy Commissioner of Behavioral Health, he oversees the Chicago Department of Public Health's violence prevention, mental health, and substance use programs. He's also a lecturer at the University of Chicago, which I hear is a good school, in social work and public health. So let me start with this kickoff question for you both. So we know that the COVID-19 crisis is creating a vastly different reality for lots of folks. How have you seen the impact on mental health amongst your patients or stakeholders? And in particular, can you talk about how the added factors of increased isolation, disruption of routine, and anxiety around the virus is playing out for those that you serve and work with?
We're going to start with Matt. He's the big gun.
Matt's got the tie, so Matt's going first.
All right.
Yeah, I mean, I think that it's, first of all, thank you. It's a pleasure to be a part of the conversation. I'm glad that you all are doing these digital town halls. I mean, I think one of the things I hope we can talk about is a conversation about social connection and community building as itself something that is a mental health intervention, and it's protective and buffering, and having a serious conversation about loneliness and social disconnection as public mental health issues. So what you're doing right now is itself, I think, a good example of that. I think, you know, there's been a lot of dominoes set in motion that are exacerbating, I think, inequalities that existed already. And so when you think about things like unemployment, when you think about housing instability and homelessness, that these issues, that kind of the frayed social safety net, increase anxiety, increase trauma for folks that in many ways were already struggling with other things. And so I think we've seen that play out in our own city clinics. We have 5 city mental health clinics that provide services to any resident in the city of Chicago, irrespective of ability to pay, documented or undocumented citizenship status, et cetera. And so we're a resource for anyone on this call, and we can talk more about that. But we've seen that play out for our patients. Not everybody has the ability to self-isolate at home. Not everybody has the ability to telework. And so folks who are living intergenerationally in the same household where it may be difficult to self-isolate, we've had a lot of folks who have concerns and anxieties about that. So I think you're absolutely right to point out that different communities are being impacted in differential ways, right? We've seen that in terms of race and ethnicity, that there's underlying inequalities there. And so we're trying as the city to really scale our response, you know, accordingly. And I can talk a little bit more specifically about what that's looked like so far.
Matt, before we turn over to Mark, where are you seeing the greatest, if at all, spikes at your city mental health clinics? What neighborhoods are spiking more than others in terms of visits?
You know what, I don't actually have the answer to that question. I can get you the answer to that. It's a good question. You know, I think one of the things we're looking at in our city clinics is we've not historically delivered services digitally. And I think Mark can talk about this dynamic in his organization. The city has never had a telemedicine platform that I'm aware of. So that's something that we're finalizing right now. We've been delivering a lot of services telephonically. Obviously, there are some cases where patients need to come in and be seen in person. Like if you get injectable medication, obviously you need to be seen in person. If it's a crisis and you really need kind of the physical grounding of being in the same space with a therapist, that's important. So we're using this moment to try to move our clinics forward in that way too, is really thinking about digital supports that we've not historically provided through our centers.
Mark, what about you? What are you seeing in your work?
Yeah, so it's great to be with you today. Thank you for having me, and it's great to be with Matt and everybody that I could see in that Brady Bunch thing. Can you hear me okay?
We can.
Okay, good. So for folks that don't know Thresholds, Thresholds is a 60-year-old health and social service and housing organization. And we provide community-based behavioral health for the most vulnerable people in Chicago, and have done in Chicagoland, and have done so for the last 60 years. And what COVID did was just sort of expose the challenges that our 10,000 clients face every day. They're the most vulnerable. These are folks that have a history of incarceration, a history of homelessness, a history of institutionalization in jails and in nursing homes. The very epicenters of COVID-19. I mean, so you can just imagine how challenging this is for us. We have 40 group homes. We have thousands of people in scattered site apartments. And so the challenges of providing services safely, effectively in people's homes, because that's what we do. Our model is called assertive community treatment. We go to where people go. And we haven't been able to do a lot of that. We've had to make a rapid transformation to telehealth. And for most of our clients, it's government payphones with limited minutes. So it's not like folks can get on their smartphone or their iPad and get the services they need. So we're doing the best that we can do, and we're doing a great job with those resources. Our staff, we have 1,200 staff people in 6 counties. It's about 300 or so are working on the ground in person. They cannot work remote. The other 700-800 are able to work remotely, and both are essential. And there's a lot of talk about who's an essential provider, and I think anybody that's doing this kind of work, whether you're working the back office or the front office, whether you're doing homeless outreach or telephonic case management, you're an essential worker to saving lives and flattening the curve.
Great. Building off what both of you talked about is trying to expand telehealth and digital health and just adapting your models. I imagine that also people are, needing increased supports for mental health, while at the same time, their access to health insurance is waning or has totally gone off the cliff. There are other gaps in their social, safety net that they would normally access that they're not able to. How are you all having to respond to that in addition to the digital telehealth means? Are you all needing to find different ways of providing services? Are you all needing to tap into different financial resources to support these needs in patients?
Yeah, so I'll jump in real quick here. So I have to give a big shout out to the governor, well, of course, to Lori Lightfoot and everything that the mayor has done and is continuing to do to save lives and flatten the curve. Most of Threshold's money comes from the state. I sometimes feel like we're a wholly owned subsidiary of the state of Illinois, and the HFS and the Medicaid program and DHS. And right from the very beginning of this pandemic, the governor and Secretary Grace Ho and Teresa Eagleson, who runs HFS, they have stood up for us. And Grace especially has said, we're going to make you whole. You keep on your staff. You keep your staff. Don't let anybody go. We're going to figure out how to make you whole. And we're working very closely with Medicaid, the Department of Family Services, HFS, Healthcare and Family Services, to make sure that we are made whole there as well. Because of what we do and how we bill Medicaid, we're losing over $1 million a month. Now, that's not a recipe for long-term success. So we're advocating at the state level and at the federal level. The biggest thing that I've been working on for the last 4 weeks, without getting too much into the weeds here, but everybody knows what PPP is now. Maybe folks never heard of that 3 weeks ago, but everybody knows what PPP. And Thresholds doesn't qualify because we're too big. We have more than 500 employees. So my biggest advocacy effort over the last couple of weeks has been to try to right this wrong. So there's no stone unturned. Poor Senator Durbin, poor Tammy Duckworth, poor Nancy Pelosi, and everybody in between. They have heard from me. This is going to require the state and the feds to step up, because what happens is if we go away or we lose staff, when we start the recovery period, which I hope is going to be pretty soon, we need to be fully staffed and ready to run.
Mark, are you seeing yet, or Matt, or I guess same question for you, and then we'll turn over to Matt specifically, but are you seeing other similarly situated agencies across the state begin to buckle or fold because they don't have access to paycheck protection or other programs?
Well, so far I've not seen it. I think that the social service safety net, the leadership of all of them, from Heartland to Metropolitan Family Service to LSSI, sort of all the too large to fail, if you will, are doing tremendously. The leadership, the boards are stepping up. People are tapping into lines of credit if necessary. We are for sure using our limited endowments to float. So I'm cautiously optimistic that both the big and the small, at least, I was going to say in the short term, no, in the long term, are gonna both survive this and figure out a way to thrive. We definitely had, and I'll talk later in the program about, the new normal that we have to create. Because while we want to go back to doing a lot of the things that we've done and done well, we need to create a new normal in healthcare, in housing, in affordable housing, in primary care. I mean, the whole thing has to, if you will, be reinvented and new ways to pay for the important work we do.
And I think some of the issues that we were experiencing before in terms of Medicaid payment reform, like mental health parity, I mean, it's an issue that Mark has worked for a long time on. If you're talking about challenges in the community mental health behavioral workforce, it's a field where, unfortunately, because of the reimbursements, oftentimes staff, the amount of money we're able to pay staff is lower. It's incredibly demanding and socially important work. And we're seeing that right now. If you have to operate on reimbursements, if that's the way you fund all your programs, and the margins were already tight, this could make things even more difficult. And so I think it just ups the urgency of our concerns about parity and reimbursement, our concerns about having a city and state plan that really supports the mental health workforce. I mean, I think those are huge issues. When it comes to our city mental health centers, one of the things that's different about our fiscal model is that we are not as dependent on reimbursements in order to stay open. We use general operating dollars from the city budget. And of course, we do bill insurance when we can, but that's a luxury that most community mental health providers don't have. And so, in this moment, I think it's a concern I have is how to best support our partners across the city. I'm concerned about the fiscal model that we've been relying on. I also wanted to echo one thing Mark said. When we talk about even what we mean by mental health, sometimes our definitions, I think, are very narrow. We really mean something like the presence or absence of mental illness. That's often what we sort of de facto mean when we say that. That's actually not what I mean. When I think about mental health, I'm thinking about like the basic elements of human well-being, which is home. It's having a safe place to rest your head at night. It's connection to other people in which you feel fully seen and fully known. It's community. It's meaning, that you have purposes in your life that, sustain you over time. It's physical health. So it's this integrated sense of health. And so, as Mark said, if we have, if we have lots of folks struggling more complex mental health issues who are housing unstable, that's going to be like a permanent challenge for our city. And part of our concept of how we promote mental health has to include housing. And it's definitely something that the mayor's aware of. It's something that we're working on right now, is thinking about big thinking around housing and how it's interconnected with mental health.
Great. When you all talk to your social workers, your clinicians, the people kind of doing the work, and drawing from your own personal experience, if we're to take it down on the individual or small level, community-based level, what are some of the practices that you are hearing as being encouraged for people to have just positive mental health during this time, or to avoid some of the more severe drawbacks that could come in this time of anxiety and uncertainty? Matt, can we start with you?
Yeah, so I would say first, like in terms of what I call self-care strategies, like there's a lot that we know about self-care strategies that support our well-being. So let's talk about like some of the ones we know. So one, and you've heard me name this before, is social connection. We know that loneliness really compromises our physical health as well. It's connected chronically to chronic health conditions. So making time to connect socially could be, if you live with someone else or through digital tools, actually feeling connected to other people, we know is sustaining and buffering for us. And so like, this is a moment potentially where you can make a concerted effort to connect with people maybe you haven't seen in a long time, or try to establish routines for getting together digitally with people that you normally would see in person. Like we have people over normally to dinner on Sunday night. We've started to have digital dinners on Sunday night, right? That type of thing. Secondly is physical exercise. Obviously we've provided guidance around social distancing outside. It's safe to be outside as long as you're social distancing. If you have physical limitations, being able to try to exercise at home to the extent that you're able to do that. Create a schedule for your day is something we've been talking to patients about, that this has thrown a lot of our lives into kind of in a little bit of chaos and disrupted ordinary routines. So trying to establish a new schedule for yourself that you can stick to. Also, if you're a parent, trying to do that for kids, right? Those of you who are parents may be smiling right now. I'm actually not a parent, but I have nieces and nephews, and I'm told that's important. And then the last thing that I would say is sleep. Sleep hygiene is super important. We try to get 7 hours of sleep a night. You don't want to oversleep and sleep too much, but trying to get on a sleep schedule, we know supports our mental health and our well-being as well.
Mark, anything to add to that?
Wow, it's hard.
Really
to add
comprehensive
to
list.
Right. I'm not sure that I have anything to add. I would add watch your food and beverage intake. Now I know that's hard to say in some ways in an era where so many people are so dependent on food and do not have access to food and beverage. But really be very thoughtful. I think a lot of people are acting their anxiety out in the kitchen. And we sort of really have to think about that, in addition to making sure that people have access to fresh produce and good food. And thank God for places like the Greater Chicago Food Depository and Lakeview Pantry and Beyond Hunger and so many others. I also think it's so important that people tap into their creativity, even if it's at home and even if it's digitally. I'm a photographer. I only really use my iPhone. But being able to walk in the Cook County Forest Preserves, which by my house are still open, imbibing nature, mostly at a social distance because I'm out before anybody else is out, and then taking great photos and then hopefully great photos and sharing them with the world. So I think tap into whatever your creativity is. Even in this crisis, some of our members, their clients, we call them members, are tapping into their creativity. And we have a thriving art therapy program and a generous donor, Blick Art Supplies, you may have heard of them in Chicago, donated to Thresholds, not limitless, but an amazing amount of supplies that are helping our people that are in recovery continue on their recovery journey through art, and the power of art and the power of creativity and color in recovery. So I think it's all of that. I think it's using the technology tools appropriately, not just skimming through a feed, but really engaging in Zoom and in FaceTime Live with people that you love and care about. What else? Do chores. Some people find those really abhorrent, but a lot of people find them really uplifting when your house and bathroom and backyard are a little bit cleaner. So all of that. One of the things that I've noticed, among all the many challenges, and the numbers are off the charts, right? 70, 80% of the population, even larger, suffering from anxiety and fear and depression and uncertainty about all of this. And all of that is real. We're one of the supporters, if you will, one of the agencies contracted by the state for a hotline, text line called Call for Calm. And we've gotten a couple hundred, I think, calls over the last couple of weeks where people are calling in, and then we respond to them within 24 hours to help sort of talk through and walk through whatever challenges they are facing. But what I want to point out is what I've also noticed is this deep resilience. And maybe Matt has touched on this already, but the resilience that I'm finding in my staff and in our members. So despite all of these challenges, people are figuring out ways with each other, even in isolation, to step up. And I see it every day. I see it in my staff who, in the homeless outreach program, are continuing to go out with masks and in proper distance to make sure that the hundreds, thousands of people with experiencing homelessness in Chicago have access to food and water and hopefully shelter and temporary, if not permanent, housing. I see it in a staff person who, with one phone call, got the Midwest Asian Health Association to donate 2,500 masks to us. I have another staff person who I call the pickup man. He'll just go anywhere to get PPE, including from the great city of Chicago, who has been a lifesaver for us in terms of PPE. So thank you, Chicago Department of Public Health. Another staff person who just was relentless and got us tens of thousands of dollars donations so that we could provide fresh meals purchased by local independent restaurants to our members experiencing hunger. And our members, our clients, the same way, stepping up. We have members, clients that are actually asking us and asking our caseworkers, asking me. I get sometimes emails asking me how I'm doing. Are you thriving? Are you okay? What are you doing to take care of yourself? So this is another sort of beauty in this tragedy, is watching people step up, just step up.
Great. Last question from me, and then I'll turn over to Emily to facilitate Q&A from the group. So it's also a good plug. If you have questions, put them in the chat. Mark, you specifically mentioned Call for Calm. What resources like Call for Calm can you recommend for people seeking additional help, either as a crisis resource or for long-term treatment or care? And if you could share the number, if you have the number.
Yeah, I wish I could. I'm going to have to turn that over to Matt. I know that NAMI Chicago, one of our great partner agencies, has a hotline and has a specialized hotline, I believe, for first responders. So I think that's another fantastic resource. Of course, the city of Chicago, the state of Illinois, and people are absolutely welcome to call Thresholds or log on to thresholds.org to find out about our services and more information out there. But I would punt that back to Matt, who probably has a better idea of what the connective opportunities are.
Yeah, I mean, there's Call for Calm is a great resource, and I actually don't have the number at my fingertips, but what we can provide it to everybody. There's the Illinois Warm Line, which is also a peer support service. So if folks are looking for peer services, that's great. The three resources, on the city side, we've been pushing a lot are, of course, I'm going to first talk about our city mental health clinics. Our city clinics are all open, where we provide services to folks irrespective of ability to pay, insurance status, documented or undocumented citizenship status, an important part of the safety net. The number for our services is 312-747-1020, and folks can call and please share that information with your networks. We want to be able to continue to provide services to new clients and existing clients, and I'm trying to onboard a lot more therapists in the next month or two because the need exists. NAMI, as Mark said, is a fantastic resource. They're another partner of us. Their number is 833-626-4244. We connect our 311 helpline to them. And so if folks have additional human service needs, applying for unemployment, if you have a housing concern or housing instability, NAMI can provide additional support and help people actually complete unemployment applications and things like that. So that's a second resource that I would recommend.
Excellent. Thank you all so much for answering our questions. And I'm happy to say that our audience here has some great questions of their own. The first one, I don't think we've touched on in detail, but it's something I've been thinking about personally. Michelle Royal has a question. Michelle, I'm going to unmute you now.
I'm Michelle Royal, Vice President QC Pride and founder of Moline, Rock Island, Davenport, and Bettendorf, Iowa. I've talked to some of my therapists and psychologists about a program, and I'm wondering what kind of plan, resources, or how to implement as we're reopening and we go into post-COVID, dealing with the amount of people who will come out of this with PTSD and being afraid to go out into big crowds and getting back to going to concerts, clubs, bars, restaurants, and those kind of things. I think there's going to be a fear until we have a cure. But even after then, you know, I think there's still going to be some residual PTSD from that. And I'd like any help or, you know, because we're not in the Chicago area, how some resources and how we can implement that here if you have any.
Thanks, Michelle.
Yeah, I'll be sure to get your contact information so I know the broad geographic area that you live in and are representing, and to make sure that our community mental health partners and behavioral health partners, both at the county level and at the community nonprofit level, are a resource for you.
Yeah, and I think, Michelle, I also just appreciate the broader point about the pandemic as a trauma, right? And so I think for some folks, I think it's been a trauma for a lot of different people, and for others, it's kind of a trauma on top of other trauma. So I've been using the phrase cumulative trauma, you know, where you know, we manage the traumas in our lives in different ways. And I think, you know, I've observed in talking to some of our clinicians and in some of my own work, you know, folks reporting like almost sort of desensitization, the way that we start to sort of disconnect when it becomes too much. And so I think we've been talking a lot, you know, part of our role as the health department is to support other care providers, right? We have our own, you know, clinics, but we also think about how to support the broader system. And I think this question about providing, I use the phrase trauma engaged care, where that became a little bit of a buzzword, but I actually think it's incredibly important that when our patients are getting services in publicly funded settings, that they can have confidence that we can skillfully deal with people's trauma histories. And I think that's only going to become more urgent for the reason, you know, that you described.
Yeah, that's so great, Matt. You know, I'm not a clinician, so I won't even try to give anything that borders on clinical advice. But as a CEO, what I am telling my staff and my board and even our members during this time, and what will be a long time, because to think that even if we open up restaurants in June and then we open up schools in September, we're in this for the long haul. I think, I don't have a time frame, of course, but it feels like there's going to be, and I think, Michelle, you referenced it, even when stuff is open, there's going to be social distancing, there's going to be crowd limitations. Right. So in addition to all this other stuff, I just keep telling people, be incredibly kind to everyone that you encounter, because you have no idea what they are going through. You may have some idea, but mostly we have no idea what people are going through. Be incredibly kind to others, be incredibly kind to yourself. And patience is your best friend. And I'm the most impatient person in the world. So it's very hard for me to even say that this is advice that I'm giving folks. And maybe I'm just giving it because I'm giving it to myself. But patience is a virtue. And I'm trying to be more virtuous with myself, with my staff, with everyone in my community. At Trader Joe's, right? I asked somebody a simple question, not a staff person, but another guest at Trader Joe's, and she barked at me when I was asking a really innocent question and like wanting to let her go in front of me. And she was like, "Why are you talking to me?" And I'm like, "I just want to make sure that I don't butt in front of you." And the exchange, which could have gone south really fast, went north, because then she smiled through her mask. I could see it in her eyes. She de-escalated, and then we waited in line for the next 10 minutes to check out. So kindness and patience and generosity of spirit, I think, are among the most important things that we can do while we're trying to do all the other stuff.
Absolutely. We have another great question, and I know Sahand has to go in about 10 minutes, so I want to get to him. Sahand, why don't you go ahead and ask your question? I'm going to unmute you now.
Great, thank you, Emily. Hi, everyone. I have a question related to the comment you made earlier about using Zoom and other kinds of digital platforms to stay connected. Zoom has kind of taken over my professional life and my personal life. So I was wondering if you could suggest any other alternatives for connecting socially besides, again, virtual hangouts. I realize we're limited by social distancing, of course, but frankly, when I spend 7 hours a day in a Zoom meeting or Zoom meetings for work, the last thing I want to do is talk to my friends through Zoom as well. So are there any other alternatives? Because I'm thankful for being able to work still, but it's definitely getting to the stage of digital burnout.
Yeah. Well, I had to punt this one to Matt too, because while I'm suggesting Zoom and FaceTime as a way to be connected, so you're just not scrolling through stuff, but actually trying to see people, I feel it, and I feel your pain, and I don't have a face for Zoom. My face does not belong on this little thing at all. So I just cringe and thinking about what I look like right now. That's why I'm averting my eyes. And
that's
I can't tell you. What's that?
That's why my camera's off.
And I just can't tell you how much I just appreciate what is now called the old phone. The number of meetings and connections with family and friends that I just want to do and hear their voice and not be connected to this. So yeah, it's so funny that the old-fashioned iPhone just by voice is so inspiring to me now. And of course, when I can see people at a socially safe distance and masked when appropriate, I really take every chance. And that's not in conflict, I think, with stay at home. My parents, lucky for me, live 6 blocks from me. I'm able to go down there and see them. It kills me that I can't hug my 78-year-old mother and 90-year-old father. I haven't hugged them in 2 months. But to be this far away or farther is so important. And seeing my neighbors often across the street, shouting a wave at somebody in the forest preserve without crossing the path. It's these little things. Matt talked earlier about connection and community, and that's what's going to restore us. And that's certainly what's going to restore Thresholds and the people that we serve. All the telehealth and digital health in the world, right. It may be necessary, but it's not sufficient. That is not going to create community and cohesion and recovery the way being with each other in non-digital ways is. So sorry, that's a long-winded answer, but I'm sure Matt is much more proficient in alternatives.
I thought that was great. I totally feel your pain on this one, and I'm experiencing the same thing. I can recommend 2 or 3 things. So I think one thing, you're right, the way that we're connecting digitally is through the same platforms and so forth. So one of the things we've been kind of toying with is, one, trying to make an intentional effort to use those same platforms to connect with people in special ways. So actually having some curated experiences that are different than maybe anything you've ever tried to do digitally before. So my mom turned 70 last month, and I'm a total mama's boy, and everything that all gay men, right? Stereotyping. Everything I've accomplished really is because of my mom. I grew up in the South, in the 80s and 90s, and it was not easy. And my mom has always been in my corner, and so to get to celebrate her digitally, I did not feel right. On one hand, I really wanted to hug her and be with her in person, but my family created a special digital experience for her. And that was, to be honest, I felt very vulnerable doing it. Because I don't actually like digital connection. It's not my thing. So it was a way of being vulnerable through this medium, right? And so, so that's one thing I would say is like, how can you use these mediums right now, maybe to connect with somebody that you haven't talked to in 5 years, and you miss them, or you feel like, gosh, how did that relationship fall off my radar screen? The second thing is like, what's the difference between spending time alone versus being lonely? And I know for a lot of us, that's like a fine line. So I've been trying to think about disconnecting at times in ways that can be life-giving. So like I've been reading a lot of novels that had been, you know, piling up on my table. And I confess, though, I recommend mindfulness a lot. I don't practice it. And we've started doing something on Fridays for our staff, which is this digital community care gathering. And like you said in your question, we're using these same platforms. And we have a meditation teacher who's volunteering to her services. And we practice this self-compassion exercise on Friday where people clutched their heart and, you know, repeated a mantra to themselves. And a number of staff approached me afterwards, and I mean, digitally approached me, and told me how meaningful it was for them. And again, it was something I never would have tried if someone else had not invited me to do it. So I wonder if there are any opportunities for you to you know, in that.
Mm-hmm. That's really helpful from both of you. Our next question comes from Andrea, and I just want to upfront say she like gives the context in her question that she comes from a place where she is employed. She has insurance and a support system, and I think she wants to know a little bit more about who needs the most help right now. So Andrea, I'm going to unmute you now.
Hi. So
Hi.
I'm a therapist. I do EMDR weekly. It's awesome. But like, who is the most vulnerable right now? Is it the older people? Is it people in the Black and brown communities? Is it the trans community? Like, from your experience, what do you think? Who is hurting the most right now? I mean, we all are collectively, but if there's one area of focus.
Yeah, it's such a great question. I mean, yes, everyone is hurting, and some much more than others. You know, the folks that I, of course, worry the most about and that are at the highest risk among the people that we serve, of course, those that are homeless. Their risk pre-COVID was enormous. Their risk in COVID is off the charts. You know, the folks that we serve that are coming out of or need to go into nursing facilities, it just breaks my heart. You know, we've been transitioning people for the last almost 10 years now out of nursing facilities into the community, and there's a virtual lockdown. We're not able to move people out. And I think in Illinois, if not nationally, over 40%, maybe 45% of all COVID deaths are in nursing facilities. Yes. So, I mean, talk about high risk. And of course, anybody in the justice system, which is a nice word for jail and prison, are among the folks that we are so concerned about, wanting to get people out as soon as possible and doing everything in our power to prevent people from going in. Yeah. And, you know, and why I said at the very beginning of my remarks that the 10,000 people that we served last year are at very high risk for COVID-19, it's not because of their mental illness per se. It's because people with serious mental illnesses almost always have a co-occurring challenge, either substance abuse, heart disease, diabetes, obesity, and it's sort of those comorbid health conditions that make it so hard for people and make them so vulnerable. So it's sort of a long-winded answer to who's vulnerable. And from my perspective, it's a huge swath of this city. And I didn't even address the challenges, as you mentioned, in communities of color and in Black and brown communities, where the rates of infection and death in both Latino and Black communities significantly are disproportionate to their representation in the city. But Matt, again, I'm on the phone. I'm on here with an expert.
No. No, I mean, I think Mark echoed many of the things. I mean, you're aware, you know, the mayor has been very concerned, as we all have at the city, about racial and ethnic disparities in infection. Mark already named that. And so our racial equity rapid response teams that are working in those communities to address immediate needs, increase testing access, increase PPE, I think trying to get access to folks, quarantine and isolation housing for folks who can't safely self-isolate at home. For instance, if you have lots of family members at home and certain people who have vulnerable health conditions, that's crucial and something that we're thinking about. We talked about older adults. I would say wage workers in general, folks that don't have the privilege of not working, right? I mean, the folks in our grocery stores, they are being heroic, right? And so, the way, of course, that our economy is structured is so much depends on employment. And, so many of the basic things we take for granted depend on employment. And I think we're seeing the precarity of that. And so I've been very worried about folks who are unemployed and essential wage workers. And it's something, as we move forward, I'm trying to think about the unique role that our city mental health clinics can play in terms of supporting, folks in that group as well.
Yeah, I'm so glad you mentioned work in particular, Matt. For people with serious mental illness, engagement in life and engagement in work is one of the biggest predictors of mental health recovery. And Thresholds has had one of the longest standing supported employment programs in the country, where hundreds or thousands of our clients over the years, tens of thousands probably, have engaged in work, in meaningful work in the community as, not in sheltered workshops, but in working at Little Caesar's Pizza, or working at a bookstore, or working for the Botanic Gardens and, the Gap and everything else in between. And what I am so concerned about are the folks that have already lost their jobs, and our folks, if you will, our members, our clients, who may not be able to return to work for some time, just because of mass unemployment, because of safety issues. So, this is where it's going to be sort of a long haul. And we know that meaningful employment for everybody not just gives money, but gives purpose.
That's right.
So we have to, solve this as we're solving behavioral health and housing and substance abuse. Employment is sort of at the top of the list. And I'm also so glad you mentioned Trader Joe's. I know you didn't mention Trader Joe's. You mentioned the grocery store. I tell, and they must be so sick of me at Trader Joe's, because every Sunday when I go in, I tell them all how much I love them. And they're like, who are you that you're telling us you love us? But I absolutely do. I really think that what my employees are doing, what the hospital employees are doing, what the nursing home employees are doing, what Amazon employees are doing, and certainly what the folks at the grocery store are doing every day to keep us fed is, it's nothing short of heroic. And we cannot tell them enough how much we love them.
Yeah, absolutely. Well, I would be remiss not to ask this final question, which comes from Theo. And Theo, just for expediency's sake, since you had a couple questions, I'm gonna ask your question directly that I think is most applicable. What can both of your organizations offer specifically, or talk about like specialized service for the LGBTQ community in this time? Are there any specific needs you're seeing within our population, or are there specific areas that address our needs as a community?
Matt, you want to start?
I mean, I think, in general, I've been in my role about a year. And so one goal that I had coming in, and it's a goal that we're working on, is really thinking about responsiveness to the types of particular identities that our clients hold. And so sometimes that's about linguistic accessibility. Sometimes it's about being LGBTQ+. And so in general, in our clinical work, we're trying to kind of build our capacity to do that work in special and nuanced ways. So that was a goal before, and I think it's even more a goal now. And I feel the same way about providing linguistically engaged work. Like we have many clients that would rather receive therapeutic services in a language other than English. We have lots of clinicians who are bilingual English, Spanish speakers. And so that's, I think, another way that we show welcome and hospitality, is engaging people in that way. I think a second thing is, you know, we know that in our community, you know, many of us, you know, as young people experienced quite a lot of trauma and difficulty. And so in general, if you look at the public health data for our city, there's a higher level of suicide risk among LGBTQ plus identified people, higher levels of trauma that have been experienced. So I worry about both of those things in this moment, because just like everybody else, we're being impacted by some of the things Mark referenced in terms of homelessness, housing instability, and it can compound onto those difficulties. So those are things we're really thinking carefully about, is which communities are we most wanting to make sure we're showing up for, and know that we are welcome and able to meet them wherever their needs are. So I think those are two like immediate things that come to mind for me.
Yeah, I echo that. And, you know, and Thresholds, we just have such a commitment to making sure that all of our staff and all of our clients, LGBTQ and beyond, feel that that they're always welcome, that their voices are always heard, and if they need services or they need support as staff, that we will be there for them. You know, I've watched many of our partners in the community. One of Threshold's integrated healthcare partners is Howard Brown Health. And man, all of our partners have stepped up, and Howard Brown has stepped up in the biggest way. When we could not get to our clients in the early days of this epidemic because we did not have PPE, and they needed to get injections, antipsychotic medications, Howard Brown, the LGBTQ Health Center, and so much more, rented a van, and their nurses went out to our clients where they were.
Awesome.
Howard Brown stood up and stands up every day. The Center on Halsted, Esperanza, Project Vita, T-Pan, Chicago House, just the most, I mean, and I'm leaving people out because I can't name them all, but I just am, it gives me goosebumps, literally gives me chills, as I have watched our healthcare and human service partners, specifically rooted in the LGBT community, step up like they never have before. And they have stepped up since the early days of the AIDS crisis and before. So I think we're very lucky as a community to have these stalwart partners that are really showing us all how to be more responsive, how to be more culturally competent, how to be our best selves and serve all who need our services.
I don't think we can end on a better note than one of strength amongst our entire community and partnership, because I know that is a huge platform of Equality Illinois, as well as just like the two of you, Matt and Mark. Thank you so much for being here today. We are so grateful for you and the work that both of you are doing right now. That lifted my heart up a little bit, so thanks for that. You all can look out for a recap of this conversation, just the recording, as well as any resources that Matt and Mark want to share with you, and the announcement of next week's speakers in your inboxes soon. I appreciate you all for being here every Tuesday. And once again, Matt and Mark, thank you.
Thanks,
we'll see
everybody.
you next week.
It's a pleasure.
Thank you so much, everybody.
Sure.
Thank
See
you.
you soon.
Pleasure to
Bye,
be on
Mark.
with you. Much love.
Bye.
Bye.